surgery for children with very complex cases and to get the care that they needed abroad as clinically appropriate. However, it is a source of great frustration to me that a total of only 19 children have been the beneficiary of that. It is a source of frustration to me that it is not higher, and I think it is a source of frustration to families who would like to travel, who either have not been offered the opportunity to travel or who believe that they would have been suitable. Of course, I do acknowledge that not every child is suitable for travel. There may be some for whom it isn't suitable or cannot travel, and there is a tension here where I believe more should be done, and there is a clinical element to those decisions, and it's not appropriate for me as Minister to interfere with that on an individual clinical basis. And yet, when I look at the system, what I see is 1,000 surgeries, essentially 500, last year, essentially 500 this year, slightly more than that, for children who have needed surgery. And in that period, 2024-2025, where the international outsourcing option was available, only 19 of that 1,000 has been done internationally. And from a systemic perspective, that's challenge. That doesn't ring true to me. And so, can I say that that has been the case to date? But we are trying to expand our international options to drive even further the opportunities to travel, both in Europe and in additional surgeries in the United States. Obviously, at the moment, we have the New York Presbytery Hospital and we have Great Ormond Street, but there has been a tender process that CHI have gone through in the last number of months at our direction, at the direction of the Department of Health and my direction, to try to expand opportunities internationally. And that is being finalised shortly, and I believe it will involve multiple additional hospitals. But I suppose the point that I'm making to the House is that if the experience to date has been that there has been an international option but not available to patients at the rate that might be suggested, at 19 out of 1,000, then it is essential that if we're providing additional international options, that there is a very clear understanding that those options should and can and should be used. And I think that's extremely important. From an operational level within CHI, the Paediatric Spinal Surgery Management Unit was established last year. It's a dedicated unit to try to coordinate better surgeries across Temple Street, Crumlin and Kappa, and it is working more closely with multidisciplinary teams to do that. And efforts to expand capacity within CHI progress, and indeed will be the subject of my dialogue with them tomorrow, including ring-fence theatres, dedicated orthopaedic beds. And to be fair, that implementation has in fact reduced the waiting times for spinal surgeries. There have also been additional outpatient clinics which have begun to assess new patients more promptly, and that is both necessary and helpful. Since April 2024, over 800 new patients have been seen in those clinics, and that has reduced the time to be seen by a consultant, in addition to the dedicated referral pathways. There have also been domestic outsourcing arrangements that have been expanded using for non-complex spinal procedures, pathways to Blackrock and Kappa more quickly. Over 74 children this year have used those pathways since the beginning of this year. And as I said, we try to expand the international option. There have been these initiatives and investment. While I express a measure of frustration with the pace and wanting to do more, I do need to acknowledge to all of the dedicated team, the nurses, the whole team, the anaesthetists and so on, and the surgeons who are doing work, that there are surgeries happening. We know children who are getting surgery, and that is certainly an increasing rate. There has been, so this year, in 2024, CHI had 513 spinal procedures. That was a 10% increase on 2023, a 35% increase on 2019. Already in 2025, 446 children have had procedures, 446 procedures have been completed, which is an 8% increase on last year. So there is growth, there is more activity. But it's also, I have to say, this year, there has been an 8% increase in referrals this year, and we are at the present time, at this moment, 7% behind target. So there's a picture yet to improve, but there's also increased referrals. What matters most, of course, is the length of time that children are waiting on the procedure, and there has been an improvement in longest waiters. At the end of October, 68% of patients on the active list were waiting less than 6 months, which is an improvement to last year, which was 56%. And further, at the end of October, only 6% of patients were waiting only 12 months, which again is an improvement on 16% at this time last year. And again, at the end of October, 38% of patients were waiting within the Sláinte care targets, though I would like that to be substantially increased. So what I'm trying to say is I will stand here and acknowledge all of the difficulties and challenges and frustrations that I have. I will also acknowledge the progress that has been made and that we want to see continue to improve. I am also seeing improvements in the outpatient list. The children without an appointment to date on the new outpatient waiting list has reduced by 48% since the start of the year. Currently, there is no child, I'm informed by CHI, waiting over 9 months without an appointment for a new outpatient appointment, and that improvement is ensuring children are seen more quickly. But we cannot let these, while we must acknowledge progress, absolutely, we also can't mask the ongoing reality that too many children are still waiting and that too many complex children are still waiting. Up to the end of October this year, there has been an additional 462 or 8% children, 462 children have been added to the active surgical waiting list. It does reflect a growing need. It also reflects a growing, a better referral pathway, but it is still children who need spinal surgeries. And there is also a shift in the complexity of cases presenting at CHI, because now non-complex cases are essentially being referred to other hospitals to be done more quickly, and that is in itself a good thing. But the complex children who may need several procedures and who may need very significant multidisciplinary support, that is something that I am concerned in relation to. I'm also concerned about the communication, and that is something that families have repeatedly expressed to deputies across this House as being something that is very challenging for them. I have made it clear that communications, the nature, the style and the promptness of communications has to change. The way in which families are discussing surgeries, surgical interventions and the overall plan for their child is everybody's responsibility, and it is not to be approached in a siloed way. It is difficult for us to build a new theatre, to recruit a new surgeon, to be fair, but it is not difficult to pick up the phone, to talk to somebody properly and in a comprehensive and timely way about the needs of their child. And these are things that can be done, and I have said this in the House before. Now, I have, to support improvement, we have appointed a spinal patient advocate liaison coordinator, and there's a patient panel for spinal services to try to improve communication. There are 14 members on that panel at the moment, and a key worker or patient navigator function is also being rolled out. So what I'm saying to deputies is that there have been efforts made to try to improve communication, though I understand from parents that the benefit of this is not yet universal. There are steps being taken and we have more work to do on it, essentially, is what I'm trying to say in a truncated way to make all of the points that I hope to make. May I address some of the different reviews and issues that are occurring more broadly in CHI historically? And of course what we want is to have a future-looking system where everybody has confidence in the system, and the difficulty with the issues of the past is that they must be addressed, that there must be transparency, and it's very, very important to acknowledge while we try to look to the future and try to improve services, we also have to hear and understand the experience of the past and indeed difficult experience of the current day. In April, I stood in this House and we discussed the HICWA review on the governance of implantable medical devices in CHI, including the use of non-CE springs in Temple Street. A month later, we were here to discuss the Thomas Independent External Medical Audit for Children's Health Ireland and the pelvic osteotomy. And at an early stage, that early stage in April, I had a very, very clear concern about the culture about orthopaedic services, as I know deputies across the House have had, and the way in which waiting lists have been managed to date and how that has operated. A month later, we had the 2022 report, the unpublished report, and the NIGAM review is also underway, phase 2 of which is reviewing the service, including the governance. So there's a series of different reports, and I'm conscious that behind every one of those reports there is a patient, there is a child. But I think what I'm trying to say to deputies is, in response to the multiplicity of reports, in response to the concern I have in relation to culture and in terms of waiting list management, I commissioned an audit, the details of which we have not yet received, and I think it's really important that we debate that when we do receive it. It has two elements. So I commissioned this via the CEO of the HSE, an audit of governance and equity in patient access and waiting list management, and that commenced in June. The audit is being undertaken by the HSE internal auditor. It is independent. I'm told it's nearing completion. I expect the outcome shortly. Importantly, and this is really important, I at the time as well asked for there to be a qualitative patient experience element to this. And I asked that Lily Collison, who is an advocate for spinal services, cerebral palsy and epilepsy and many other things, and is a member of the HSE board, that she would complete that. And so she has been in CHI on those past number of months doing a survey of parents, speaking to parents who wish to speak to her and trying to better understand the patient experience. How did you end up on this waiting list? What is your experience? How have, what has happened to date? And I expect her report shortly. I didn't publicise her name at an early stage because I wanted to give her the opportunity to get on with her work in a quiet and effective way and to give her the privacy to do that. But I think it's very important to say we did both of those things at that time, and I expect to have that report very shortly. As well, I won't address the spinal task force, which continues to work just out of a question of time, but I do want to talk about the inquiry that the Cabinet agreed to yesterday. And it is our intention to have a statutory public inquiry into the care generally received of children with scoliosis, complex scoliosis, spina bifida, hydrocephalus, and the care issues around that. It's really important now that I become really extremely careful with what I say about the detail of that, because I'm conscious that we want us to establish a process that is legally robust, that has very clear terms of reference. We have asked, and the parents and the advocacy groups, indeed the breadth of stakeholders, including the advocacy groups that are on the spinal task force, for example, all of them to engage with a facilitator, the attorney who will help listen to understand the best scope and help develop a proposal to me so that I can properly draft terms of reference and have those agreed by government. It's the intention to do that with families in the most appropriate way, recognising that it is, of course, government and the Oireachtas that has to ultimately sign off on them. The Attorney General is already engaging with potential people, potential names, senior counsels and so on, to determine who may have availability to do this work and to get that going as quickly as possible. Of course, the calibre and the quality and the experience of somebody who we want to do this work isn't always immediately available tomorrow. They have schedules and commitments already, so we are trying to do the best to get somebody as quickly as possible, but also who is as capable as possible as doing that. I'm very conscious that my colleague is going to speak, and I don't wish to speak across her. So I can address any questions that deputies have perhaps in my concluding remarks, because I'm conscious there will be a lot of interest in that. And of course we are continuing with the journey in relation to the integration of CHI into HSE. I'm not sure that I've had the opportunity to formally update the House in relation to the board members that have been appointed, the chair being confirmed by Cabinet there, I think, last week, and that is work that is ongoing, and that we will need to now prioritise the legislative element of that and bring that to the House, I hope, in 2026 to begin the process of making that transfer more formal. But I do wish to give my colleague the opportunity to speak, so thank you.
Minister Manair O'Connor.
Thank you so much, Minister, and I want to thank you for your opening statements, and and I know how hard you have been working on this for the last few months. And look, I suppose my heart goes out to the families like yourself that we're thinking of them, and children that are waiting lists, waiting for surgery, and those who have lost children. And it is right to say that we are not where we need to be, as you have said, Minister, but we need to address the urgent problems in the spinal care. And as that's what you said, despite sincere efforts of successive ministers, and that's true. I want to acknowledge again, Minister, your work in this in the recent months in driving measures to address the urgent problem. I know you've met with the family of Harvey, and you're also working to improve access to services are underway, including a ring-fenced theatre, extra outpatients clinics, and a national and international outsourcing to maximise capacity. Every effort is being made to reduce waiting times, but we know that there are still challenges and reform is needed. And again, I welcome yesterday the Government approved the Minister's proposal for a statutory public inquiry. I fully support this inquiry, and I have met with affected families from my own area, and I know that they are keen for this inquiry to take place as soon as possible, and it is a very important step to ensure that we have the best healthcare system possible for our children. Every child's journey to spinal surgery is different. Some steps may take longer, especially when the case is complex and several specialists are involved. Every precaution must always be taken to make surgery as safe as possible and to ensure that the children who need complex care are fully prepared and their care plan is the right care plan for them. And I understand that this can take time. Strengthening governance and oversight, driving down waiting times, ensuring increased engagement and timely communications with family must be a priority. And again, as the Minister said, working with families and making them a priority, that is really important, and I know you're also committed to that, Minister. We must work to ensure that there's a cultural change so that families can have the trust in the system. And I know that the CEO of the HSC has established the CHI Improvement Steering Group and has commissioned an audit to assess equal access to care in CHI, and this is a welcome step. We must continue to listen to and work with parents and the advocacy groups who are highlighting hugely worrying and important issues. And I, like you, Minister, I've been there and I've been speaking to families and I've been working with families. And Minister, I can assure you that I will be working with you to give any help and support that I can. And I know that the government is committed to this. And as the Minister has said, our aim is that children receive the care that they need when they need it. And I look forward to the inquiry taking place as soon as possible. Thank you.
Minister, Deputy David Cullinan.
Look, in 2017, Taoiseach Simon Harris made a promise to children with scoliosis and spina bifida that long waiting lists would essentially end, that children would no longer wait in pain, deteriorate or lose the chance of life-changing and, in some cases, life-saving intervention. He promised that no child would be left waiting longer than 4 months for surgery. And since then, as we know, countless children have suffered in agony without surgery within 4 months, and in many cases, tragically, without surgery at all. And we have to go back to the very beginning. Children's Health Ireland was legally established by Simon Harris in 2018. And yet, from its first days, it has lurched from crisis to crisis, and the children who depend on the services have paid the price. CHI, as we know, was formed to amalgamate essentially the children's hospitals in Dublin with a promise to provide a world-class service for children. But despite the Trojan work of healthcare workers in Crumlin, in Temple Street, in Kappa, and I do know that there are many, many people who work in those hospitals who provide a tremendous service, the promise of providing a world-class service for all children never materialised. And at the heart of this is exceptionally poor governance, made worse by 4 years of delays to the new Children's Hospital, a hospital that has made a mockery of the state because of a fundamentally flawed contract. And it has to be said, another calamity with Simon Harris's fingerprints all over it, because he was, after all, the minister who greenlit that project and signed off on the contract. We know that children with spina bifida and scoliosis have waited far too long for essential surgeries. Even today, there are 232 children on waiting lists for spinal surgery, with most of them waiting longer than 3 months. We don't know how many are waiting longer than 4 months because CHI doesn't publish that information. And again, even when it comes to waiting lists and how waiting lists are presented, there is an appalling lack of transparency. But what we do know, Minister, is that behind every number is a child sometimes in pain, losing mobility, getting worse. The waiting list figures are concerning. The number of children without a date for surgery is up to 139, and another 43 are waiting on a date for a further procedure. Only 9 actually have that date. The rest are suspended for various reasons. One child has now been waiting over 48 months for surgery, more than 4 years on the waiting list. 7 more are waiting over a year. And children cannot wait months or years for time-sensitive and, at times, life-saving and life-changing spinal surgery. We know that many have not received proper pre-operative or post-operative care. And we also know that many children are staying in hospital longer than expected because of high infection rates. This means many children stay in for weeks instead of days, causing distress, causing pain, time lost in school, time lost with family, and causing knock-on delays for other children waiting for care. And families tell me that they are not being given the real data on infection rates, so they cannot give proper informed consent. They are told to trust an organisation which has repeatedly abused and broken that trust, according to those very same parents. One of the saddest failures in CHI is the abandonment of a group of children who came to be known as the Crumlin Orphans, a group of children left without the care of any consultant in orthopaedics or urology. When this group of children was identified by what is known as the Dixon report, CHI said nothing. In fact, they never published that report, and worse than that, they never accepted the findings, despite the fact that we all know that the findings actually were conclusive and were correct. CHI could not even say how many children were in this group. When this issue was identified again a few years later in another unpublished report, CHI still did not know how many children were in this group. And this is a group of children, Minister, who simply fell through the cracks. But it is not that nobody did not know this. The parents knew. They were screaming from the rooftops, but nobody in CHI management or in government buildings were listening. And since then, we had the case of unauthorised, non-medical grade springs being implanted in children's backs. The HICWA review of these cases found severe governance failures which allowed these tragedies to occur in the first place. HICWA found a lack of formal approval processes, inadequate oversight, poor record keeping or a lack of consent from parents. The Minister mentioned that, and poor communication earlier, poor tracking and traceability of devices and hygiene standards, and exceptionally weak clinical governance structures. And these were not one-off lapses. It was the product of a system where governance was weak, where oversight was absent, and, as the HICWA report said, where children were not protected from the risk of harm. And this scandal goes beyond spinal surgery waiting lists. We also know that there has been potentially hundreds of unnecessary hip surgeries carried out on children. We have unpublished reports raising even more serious concerns about how CHI is governed and how children's services are delivered. We're still waiting on the NIAGAM review. That may be next year. We were promised interim reports. They never materialised. And we still have questions over new funding for children's orthopaedics. The Minister mentioned funding available. There are question marks around whether that was sufficient, whether it was targeted, and whether it will deliver the capacity that children urgently need. And if anybody wants to understand the cost of these failures, then they need to look no further than the case of Harvey Morrison Sherritt. Harvey Morrison Sherritt was just 1 year old when the Taoiseach made his 4 months to surgery promise. And it took another 7 years for Harvey to get that surgery. And during the delays, Harvey's spinal curve deteriorated from severe to catastrophic. By 2022, his spinal curvature was 65 degrees, and by 2024, it had reached 110 degrees and then 130 degrees. Harvey was placed on an urgent waiting list for scoliosis surgery, but he was also taken off that urgent waiting list, and his parents still don't know why. Why was he taken off? Who took him off? And I know the inquiry obviously will have to answer those questions. What we do know is that it happened without the consent of his parents, and his parents were not even informed. It's breathtaking to think that that would happen. And it has since come to light that Harvey was allegedly and wrongfully removed from the list because he was listed as a palliative care patient, despite the fact that a consultant at Great Ormond Street had assessed him and found him as suitable for surgery, which compounds, I think, the anger that the family justifiably have. And while there was still potential to save young Harvey's life, it seems that obviously someone took him off the list, and worse, it seems that someone decided not to communicate that to his parents. And it was only late last year when Harvey eventually received his first surgery. Harvey's condition was entirely treatable. As far as I'm concerned, Harvey's parents, Stephen and Gillian, have campaigned with extraordinary courage to get the care their son needed. But after years of delay and avoidable decline, Harvey tragically passed away in this year, 2025, at the tender age of 9. Harvey was entirely failed every step of the way. CHI failed to give him the care he needed and when he needed it. And his case is now a defining symbol of systemic failure. And when I think of Harvey, Minister, I also think of the countless children and young adults who have been failed by CHI. I think of Dulciana Carter, who died at 10 after complications with her surgery on her spine in Temple Street. I think of young TJ Coughlin, diagnosed with spina bifida and scoliosis, denied early intervention, and now told his condition is inoperable because he spent his childhood on waiting lists. I think of Mikey Henry from Mayo, who is still waiting for care. In fact, I think his parents have reached out looking for a meeting. These are just 3 children, and there are many more names that we don't know. But we do know their names, and the reason why we know their names is because their parents were forced to campaign and go public and have their cases raised here in this chamber. And it's only because of the courageous work of advocates that we know any of this, because if CHI had their way, none of this would have come to light. And the tragedy here is that if the government had listened to parents and advocates sooner, we may not be here today discussing this issue at all. If they had delivered the resources and funding sooner, many of these tragedies would have been prevented. And I want to pay tribute to Stephen and Gillian, Harvey's parents, as I have done in the past, but also to Amanda, to Una, to Claire, and to all of those advocates, all of those mothers and fathers who went above and beyond the call of duty, who became advocates for others, not just their own children, and also the whistleblowers, Minister, who came forward. And I think we owe them a debt of gratitude as well. What is needed now is not another internal review, not another limited report, not another chapter in a long pattern of deflection and delay. What we need is a full, independent, statutory public inquiry, one that is fit for purpose, one that can establish the facts, one that can trace decisions and failures, and one that can finally deliver real accountability. And crucially, this inquiry has to have the full backing of families and advocates. It must be developed with them, and it must get answers to the questions that they have. And also, Minister, it's important that we improve the services. Well, we have the inquiry, and the inquiry will be established. It's equally important that we invest in services. We have to make sure that every single child has timely access to care. And I know that after dealing and talking to many parents, it's not just the surgeries, it's the pre-operative care, the post-operative care, the totality of that child's care, which is really important. So I'm thankful for the opportunity to raise these issues today. I know that we're going to have an inquiry, but we will watch the terms of reference and see exactly what that inquiry will be, and I really hope that it is fit for purpose. I hope we see full cooperation from everybody involved. I hope all of those children get justice and those families get justice, that we can learn from this, but also crucially invest in the services that we need to invest in.
Thank you, Deputy. And just before I move forward, and it's not a reprimand to Deputy Cullinan in any way, it's to be mindful when we mention children's names as to the consequences or a request to have that deleted from the record. That's all. Everybody, I'm sure, is well aware, but just a reminder. Thank you, and I move now to the Labour Party Deputy Marie Sherlock.
Margaret Ceann Comhairle, and I very much welcome that we're having these statements today. And I suppose, Minister, just to say and to welcome, I suppose, the big breakthrough that has happened over the past week in terms of the agreement to the inquiry. And obviously we have to see what exactly the form of that inquiry is to be. But I think the scandal after scandal that we have seen in spinal services within CHI over many years, it is very welcome that there is now going to be a proper investigation of that. And I suppose as I rise today, and I know we've had statements before, and have paid tribute to the parents of Harvey, Morris and Sherritt, but I think in particular the revelations that they have had to encounter over the last fortnight, I want to pay tribute to their immense dignity and strength, incredible strength in the face of their absolutely devastating loss, and for it to be played out so publicly in terms of just how badly failed by the health system that should have been there for their son. I'm also hugely mindful today that when we talk about spinal services for some children and young adults, it is now too late because of the failures within the system, and they carry those questions for the rest of their lives about what could have been if their treatment, if their care had been different, if those failures had not been present. And to those families who are currently fighting for surgery, of which there are many, there's a bitter irony that some of these children, the most sickest children in this state, and yet their families are having to put up the greatest of fights for the appropriate care. And that is wrong. And while we talk about the patient and the child and the family at the heart of this, we do know that there are some nurses, some doctors, many nurses, many doctors who are going in, day out, into a very difficult work environment, trying to do the best by their patient. But unfortunately, there is a system, there are some decision makers there are some clinicians who have failed in their duty. And that is what needs to dramatically change. I don't think it's an understatement to say that we've had a national scandal in terms of what has happened. And when we look back, I think in 10, 20 years, we'll wonder how have children so been badly failed. That, you know, these are children who've been in the health service for a long period of time. Their conditions have been recognised for a long period of time, and yet the systems of care have failed so badly. So I do, in that context, want to welcome the government's announcement that they will have an inquiry, but I suppose I have to ask, what is it going to lead to? Because to my mind, it's not just about what has happened, but what is currently happening within CHI. And if we think back, and you know, other deputies referred to this, over the past 8 years we've had at least 5 reports into the failures within CHI. So we had the Dixon report, which now seems to have been disowned by CHI because it was then obviously to Temple Street. We've had the Boston report in 2023. We've had the Hickory report, which was commissioned in 2023 and published early this year. The Simon Thomas report, as you referred to, Minister, and of course we're awaiting the NIAGAM report. And between the Boston report and the Hickory report, we've 59 recommendations as to how to overhaul services within CHI. Recommendations that all arise from the same dysfunction, the lack of proper processes, toxic culture, appalling management and lack of collegiate responsibility. So the reports themselves, of course, should be sufficient to bring about necessary change. But I think the government's agreement to a statutory inquiry, or to an inquiry, is an admission that they are not. And I suppose the devastating allegation that Harvey Morrison shared was moved to a palliative care list is a really distressing new low for CHI, because if it is true, how could anybody in good conscience make that change and not follow up as to how that child was doing? And time and again, you know, we have this bitter irony that we're not talking about thousands of children, we're talking about a small number of children who have been so badly failed. And as one parent said to me, whose child has now passed away, her child became a political football, political with a small p, between consultants, between the egos of consultants. And while I said I think there are some really good spinal surgeons out there working in our system, we have to ask, how do we get to this place? So with regards to what is happening now, we know that the list is longer this year than it was last year, Minister, as you alluded to, 139 on the list now. So there's an element of you're not even running to stand still. We understand that no child has been scheduled for treatment abroad over the last number of months, and we've heard your frustration on this, Minister. And of course a big deal was made about referring children to Great Ormond Street or Morgan Stanley. I have one family who tell me that their child is 12 months on the waiting list. The child has been told the child needs surgery. The family believe the child can travel. They have not been offered that option to travel, and indeed when they spoke to their surgeon, they were told that that surgeon does not have a list in the Blackrock Clinic, so therefore would not or could not refer that child to the outsourced option, whereas that option appears to be available to other children. So how can we have a dysfunctional system? Indeed, how can we have one surgeon deciding who gets outsourced, whereas another surgeon cannot? This is the dysfunction that is at the heart of CHI. And so with regards to this inquiry, so much is riding on what this inquiry will produce, where it seems a number of reports have failed. And obviously it's really important that we'll have compellability, because ultimately any inquiry is as good as the participation, the fulsome participation of the clinicians and the management participating. And I think there are serious questions as to whether they will participate willingly or not. And I believe, and I think we in the Labour Party believe, compellability will be important. It's really vital. The advocacy groups will be there all along the way. And I want to pay particular tribute to the tenacity and perseverance of the Scoliosis Advocacy Network and the Spina Bifida and Hydrocephalus Paediatric Advocacy Group, because many of those parents already have so much on their hands trying to care for their child, and they're fighting for their family, but they're doing much more than that. They're fighting for other families who don't have that capacity, and it's absolutely exhausting, and they've been at it for years now, so many years. So the critical thing for us with regards to getting the truth and the accountability and the justice out of this inquiry is that we believe a twin-track process needs to be in place. There'll obviously have to be a series of stage reports, and that firstly we need a module in terms of whether CHI is actually implementing the change that it has promised to deliver. So in effect we need a process whereby there's a mediated process whereby the record is set straight between clinicians and parents as to the status of that child's care, because all too often we have parents coming. I have parents coming to me. I know there's parents coming to other deputies here who feel gaslit, who feel they're not being told the truth, who feel they're being told conflicting stories by the clinicians, by the health staff that they're having to interact with. And I hear what you said, Minister, with regards to the process that is already up and running with regards to that lady who is already interacting with those families. But it needs to be a mediated process between the clinicians and the families, because ultimately many of the families feel they are not getting the truth that they so rightly deserve. I suppose the second key thing obviously is the investigation and the inquiry into the deaths of the children who have passed away because of the failings in care, and those children for whom surgical intervention was too late. To my mind, inevitably, there will be allegations that will lead to litigation and all of this, and it will potentially go on for a very long time. So I suppose, Minister, our quest to you, and we believe the onus is on you to ensure that this inquiry will deliver the answers that we all so much need as the public, and particularly for parents, but that this inquiry can get those answers and may turn adversarial, while also ensuring that the system improves. And I think there are very real question marks about how that can happen, with obviously a very limited number of staff at the heart of these questions over the coming years. That would be no easy task. We in the Labour Party have said for many months now, obviously, that the HSE needs to take over the board of CHI. We very much welcome your move in that regard, Minister. We urge you to move with speed with regards to that. Obviously, it is no silver bullet, but I think it will be progress. But I think ultimately the biggest question in my mind now is getting this inquiry right, getting the answers, and making sure that systems improve at the same time. Because ultimately the people needing to provide the answers will also have to improve their act with regards to the services.
Thank you, Deputy. Deputies, with the agreement of yourselves, Deputy Doherty missed his slot due to a conflict with committee. I'm asking, would I propose that he would take his 4 minutes? With the agreement, it won't put anybody out. It's the 4 minutes that we're ahead, if that's all right. That's Deputy Doherty, 4 minutes. Thank you, everybody.
And thank you to members for the facilitation. We are here today because of the heroic efforts of parents of children with scoliosis and spina bifida, and because of their determination and because of their love of their children. We're also here because they never stop fighting tooth and nail. Particularly, we're here because of the parents of Harvey Morrison, Stephen Morrison and Gillian Sherratt, and they found the will, even when grieving the loss of their son, to take on this government. And I can't imagine the suffering that they've been through, or even fathom, as a parent myself, how they find strength to keep fighting. They want to know how their son and many others could have been failed so badly by the state, why children continue to be failed in the most horrifying ways. The removal of Harvey from surgical waiting lists to be treated as a palliative care patient without any discussion with his family is the most recent shocking piece of information to come to light. But what else remains hidden? What other cover-up in the hope it never sees the light of day? And let's be clear, a public inquiry is no one's first choice. People want public services to work, for the state to function properly. When things go wrong, people want to see a system that can respond. Instead, we have a system that is threatened by transparency and allergic to accountability, that looks to protect itself at all costs. When all else fails, people expect the government they elect to be on their side, not to turn a blind eye to their suffering. A government that takes responsibility, not leaders that default to spin and deflection when people are crying out for help. 8 years ago, Simon Harris promised no child would be waiting longer than 4 months for scoliosis surgery. That promise has never been delivered upon. It is a shameful chapter in this state, and it is not over. And how could this ever have happened? How could failure get stacked on failure without any accountability or action? The HSE, as we know, was set up in 2005. It was billed as some type of innovation at the time, but it had created a buffer between the Department of Health and the government on one hand, and the health service and the people within it on the other hand. At the time, Dr Liam Toomey, who was a TD representing Fine Gael at the time, said, "One can only imagine the scapegoating that will be due to the CEO of the HSE when the government fails." Well, last year, the then Taoiseach of this state, Simon Harris, fulfilled that bleak prediction. It was put to him that he and his government had actively, consistently and comprehensively failed children with scoliosis and spina bifida, that children's spines twisted and curled, leaving them in agony, as little rib cage pressed against lungs, making it more and more difficult to breathe, that children were left waiting so long that they became inoperable. When all of that was put to the Taoiseach, he said, and I quote, "It was said to me by the then Director General of the HSE that the Executive would have put a plan in place to ensure that no child waited longer than 4 months." End of quote. So the Taoiseach of the day, the former Health Minister, saying, sure, he's only the messenger. Someone told him that they would make a plan, nothing to do with him. And that's why we're here today. That is why we need a public inquiry. It is because of gross political failure, a failure of leadership. Children and families have been left with no option. A public inquiry is their only hope. It has to deliver the answers, it has to deliver accountability, and it has to deliver real change. And that is why the process needs to be fully independent of Children, Health Ireland and the HSE. Finally, I just want to commend every single parent and their families, every single loved one of those children who have been failed by this state, and we commit on this side of the House on behalf of Sinn Féin to never give up and to continue their fight with them.
Thank you, Deputy Cahill-Crowe.
Could I let my colleague go ahead if that's possible? Sorry, my apologies.
Thank you very much, Cancrola. It's very important today to speak on this issue for children and families who have been let down. I'm devastated for them, and right across the House, we're angry, we're upset, because what unfolded in our paediatric spinal service is not some just abstract policy failure. It is a human tragedy. It's a breach of trust. It's so profound that any parent would question how they would ever rely on a system ever again, and a system that would left their own child waiting in pain. Yet I am glad to see the state now confronting this horrendous situation fully, confronting it and how we allowed children suffer under our watch. I appreciate and respect the work that you are doing, Minister. You are clear and unapologetic in your statements, and the country now knows of the heartbreaking story of Harvey Morrison's Sharat, a 9-year-old boy removed from an urgent spinal surgery waiting list without his parents' knowledge or consent. Parents were begging for answers and that never came, and now those same parents live with their unthinkable grief. No parent in Ireland should ever fear that their child has simply vanished off a waiting list. No parent should be forced to battle a system that feels faceless, careless or evasive. And no child should ever be left to suffer because of a broken system could not protect them. And that's exactly what happened. In my previous contributions to this House, I firmly stand over them. I said that when the state asks families to trust us with their children, we must be worthy of that trust. And in the case of Harvey and so many others, we were not. And now families across the paediatric spinal services understandably ask, will this ever change? Minister, I know you are committed to that change, to rebuilding that trust, ensuring that our children receive the care that they deserve. Yes, progress has been made. Additional clinics, a ring-fenced theatre, increased activity, 446 spinal procedures this year, reduced long waiters, and more children are being seen sooner. These reforms matter, and I acknowledge the extraordinary staff who are pushing beyond all reasonable limits every single day. But numbers will never balance the scales that of a loss of a child, the ill treatment of a child. They cannot ease the fear or stress or the anguish families feel watching their children deteriorate while surgery seems endlessly out of reach. We now have multiple reviews underway, and Minister, you highlighted them in your contribution. They will be important, but reviews alone do not heal the trauma. Families need the truth, they need justice, and they need a system that will not hide from the convenient ambiguity of fractured governance. That's why I'm delighted at the government's decision to move ahead with the full statutory inquiry, beginning with the facilitator to scope its terms of reference. It's not just welcome, it's essential. It must be thorough, and it must place the voices of children and parents at the centre. We owe the parents nothing less, and we owe every family living in fear nothing less. Reform cannot pause while inquiry proceeds. Communications failures must be fixed, and you noted these in your speech, in your contribution as well, Minister. Clinical governance has to be tightened, not on paper but in practice. No child must ever again be removed from a list without explanation, and capacity must continue to expand so children are treated before harm becomes permanent. I want to acknowledge the significant structural reform now underway. In September, Minister, you confirmed your intention to integrate Children's Health Ireland into the HSE. The decision follows careful reflection on the governance structures underpinning our health system, engagement with stakeholders and discussions with government colleagues. It's really important. We spoke about this in previous contributions, that our faith in CHI had diminished. I suppose, finally, Minister, I want to say directly, Minister, I wish you the very best as you take on this work. This crisis was not in your making, but it's absolutely in your hands now. But I'm confident you will bring this to conclusion. I know you are committed to ensuring that families and children finally get the timely, proper care and the answers and the justice and the decency that they do deserve. While none of this is easy, I believe you have the determination to bring it through.
Thank you, Deputy Crowe.
Thank you, Count Corla. Glad to have the opportunity to speak in this debate. Sorry, I was gathering notes there just when I came into the chamber. Look, at the outset, I want to join others in firstly, I suppose, referring to Harvey Sherratt, the poor little guy, and all that he endured, and the arduous campaign his family have had to wage ever since for justice. I think it's very important to recognise that there's finally going to be a statutory public inquiry that they have long sought, and I look forward to that getting underway. Minister, I know these are statements, but at the end of these statements you do get to respond to some points raised. I hope you might just give some detail, because we've gotten certain briefing notes on what's at stake here. We've read about in the media, but I think it'd be important that whatever additional detail you can give today in terms of that statutory public inquiry, that you might outline what. These public inquiries are very important, and don't get me wrong, I think this was the campaign all across the summer. Indeed, Justice for Harvey trended on X, formerly Twitter, for several weeks, and it was front and centre of all newspapers in this country. But a statutory inquiry is crucially important. It was central to the ask of the family. It's been a central political ask here in these houses for a long time. How long will it all take, I suppose? Because Harvey Sherratt, there are many Harveys in Ireland, unfortunately, in queues, not knowing, their families not knowing when will they get this all-important medical care, what will it look like, when will it happen, where will it take place. So I think a statutory inquiry is important, but timelines and some parameters, I think, would be helpful at this point. Can I just secondly say that there's a whole other body of inquiry and investigation underway, CHI, suspended surgeons and all of that, and I don't want to get into the depths of all of that. There's two sides to this, though, I feel. There's certainly unapproved medical springs used, and I think that's been well documented, and you, Minister, and your department are very much involved in it. There's been an in-depth investigation in that. But I also would say, I'm not going to name people here today, but there's a body of parents, I've met them, and I think many other members here on both sides of the House have met them, who would feel aggrieved that one of the key surgeons that their children was on the list to see is no longer performing surgery in Ireland. For many reasons, and that has to work its way through, and there's due process and all of that. But one issue that was mentioned to me, and I wish to state it here in the Dáil record, was that at an Oireachtas Health Committee meeting which took place on July the 8th, 2022, a spotlight was shone by someone on €90 million scoliosis surgery fund, which was misused, I suppose is the way to put it, and that too, it's believed by these parents, has been a stick to beat a certain surgeon. So I think it's just important to say that on the record. So, Minister, in your summing up at the end of this, I ask that you might give any additional detail that you're able to give us here in the House regarding that statutory public inquiry. It would be very much appreciated. And like others, like the previous speaker, my party colleague, you're in this job now, is it 9 months or 10 months or so? I have full faith in you to fulfil your duties. Not a problem of your making, but you will be the Minister that will oversee the statutory public inquiry, the establishment of it, please God, the outcome of it. And I think it's very important that throughout that process that Harvey's family would not be locked out of things. I know when inquiries are set up, parameters become very rigid, and but I think there needs to be delicate handling of this. I think they need to be front and centre to everything that happens over the coming months, and there needs to be ultimately a strategy that's effective, that doesn't involve arduous waits, and that children who have scoliosis have a pathway to treatment. Thank you.
Thank you, Deputy. And now back to Deputy Rose Conway-Wall.
From the outset, let's just make it clear, we've only reached this point of establishing a statutory inquiry into the failures in paediatric spinal care in Ireland solely due to the brave families and advocates who have forced this government to act. But I do want to acknowledge, Minister, you have listened to the families now, and the families are taking you in good faith that you will do what they are asking you to do. It should never have taken years of campaigning and media appearances and unimaginable heartbreak to secure a statutory inquiry. But these families refused to be silenced, and now they deserve the truth and proper accountability. To do these families justice, this inquiry must be fully independent, legally underpinned and completely free from influence of CHI and the HSE. And there must be compellability. There must be compellability. CHI has resisted transparency for far too long. Only an inquiry with real powers that moves quickly, compels cooperation and establishes all of the facts can deliver the truth and rebuild trust in the system. Now, this inquiry stems from a broken promise in 2017 from Simon Harris, when he pledged that no child would wait more than 4 months for scoliosis surgery. So years of delays have led to disability for many children, and for others, like Harvey Morris and Sherritt, it cost them their lives. Harvey should have had the surgery when he needed it. Instead, he and his family were failed again and again by a system that hid the truth. The revelation that Harvey was removed from the surgical waiting list and treated as a palliative care patient without any discussion or disclosure to his family is profoundly shocking. No parent should ever learn after the fact that their child was effectively given up on the system, and that was meant to, given up by the system, that was meant to protect them. I again want to send my sincere condolences to Harvey's mum and dad, Gillian and Stephen. I think we're all mindful as we come up to Christmas how absolutely excruciatingly painful it must be for the family and for other families as well. But shamefully, Harvey is not alone, and in my own constituency you'll know of Mikey Henry Benson, and I do want to thank you, Minister, for meeting them on Monday as well and giving them the time and listening to what needs to be done, because I want to make the point that while the inquiry will cover what has gone on in the past, the scandal of what has gone on in the past, we have to keep the children alive that are still alive today, that absolutely have been neglected, but they are alive and they must be kept alive at all costs. And I know we will work with you to ensure that that is done, but there is a real urgency around what needs to be done, and other ancillary supports that are needed for these families need to be done as well, combining with the disability services.
Deputy Pádraig Rice.
I too would like to welcome the establishment of a statutory public inquiry and the decision by Cabinet and the decision to appoint a facilitator on that matter. This public inquiry must have the power of compatibility to establish facts. It must be independent, and at the centre of this must be the voices of the children, their parents and the families, and crucially these families must get the answers to the long list of questions they have. The public interest must be at the heart of this and nothing else. It must not be rushed, but it cannot go on forever either. Having looked at some examples of tribunals and commissions of inquiry, I've yet to find one where I think the state has got it right. I think there's real challenges in setting this up and getting one that's fit for purpose. So there is a real challenge here to get a public inquiry that meets the needs of the families and the parents and gets them the answers, and that doesn't get stuck in legalistic disputes and huge costs and runs for ages and ages and ages. And I think we need to learn from the lessons of the past in this regard. In particular, I think we need to learn from the Grace case and that commission investigation. Inclusion Ireland published a damning report into that inquiry just last month. They said, from the outset, the design and approach of the commission sidelined and devalued many of those most affected by the issues it was considering. And that can't happen here. We can't have the voices of the children and the families sidelined. The public inquiry must be fully human rights compliant and based on models of best practice in other jurisdictions, such as those identified by Inclusion Ireland in that report. And hopefully that can be looked into. Minister, when you were talking about some of the issues in CHI, you talked about some of the reports published in the last 2 years. We've had reports in this area going back to 2013. There was a report into services for children with spina bifida, found major deficiencies in services at a national and local level, limited coordination of these services. That report made recommendations for services improvements that were never implemented. 2017, the Ombudsman for Children report found serious and ongoing violations of the rights of children waiting for scoliosis treatment. In response, the then Minister for Health, Simon Harris, promised no child with scoliosis would wait longer than 4 months for surgery. Moving on to 2023, the Ombudsman for Children published a report into CHI's care of Ivy, a child with scoliosis. The report found numerous failings of governance and communications within CHI. Ivy had been waiting for spinal surgery for 5 years, during which time her curve of her spine went from 30 degrees to 135. 2023 also saw the Boston Review, which found that infection rates at CHI were way above international norms. 2024, there was a follow-up report into Ivy's case was published and revealed that the surgery had been delayed for so long that Ivy was no longer operable. 2025, we had the independent audit that revealed nearly 80% of hip surgeries on children at Kappa and nearly 60% in Temple Street were not clinically indicated, meaning potentially hundreds of children underwent unnecessary surgeries. Same year, HICWA published a report into the use of unauthorised springs in children's spinal surgeries. Springs were implanted into children with scoliosis, with HICWA finding that there was no evidence of ethical approval, also identifying issues with culture, governance and internal communications. A report compiled in 2021, which CHI refused to publish in full, was leaked and uncovered bullying and a workplace culture that has the potential to put patients at risk. We also know there are outstanding reports. There's an IM review into spinal surgery at CHI, commissioned in 2023. The 2017 Dixon review into paediatric urology services remains unpublished, with CHI rejecting its findings. And we also have the audit into the waiting lists and equity of access that the Minister mentioned. So we have here evidence of over a decade of failure and findings that need to be implemented and need to be put in place. And we can't have this inquiry stop this reform of all of these recommendations and all these lessons that need to be done need to be put in place, and that work needs to continue. We also need to see continued reform of the culture within CHI. We know from parents and from advocates the real issues around transparency and the culture within that organisation. Una Knightley, the co-founder of the Spina Bifida and Hypercephalus Paediatric Advocacy Group, said, "CHI is not an entity that values transparency. You must understand it functions on a reactive basis to political, media and advocacy measures. They do not follow any rules in terms of giving parents the information about their children. They know parents have nowhere else to bring their children." And I've seen this myself in terms of some of the parliamentary questions I've submitted to CHI, and they had refused to answer questions, saying we were almost too busy to answer your questions, sending back to them, and we had to push back on that. I don't think it's acceptable. We do need to see greater levels of transparency and accountability from CHI. And we also must not forget those children who are waiting today and continue to wait on long waiting lists for these services. 233 children on CHI spinal waiting list, 139 on the active list, which is up from 112 in January, 45 waiting longer than 6 months, up from 37 in January, and at the moment we just have 5 children are listed for surgery abroad, and in total only 19 children have availed of these surgeries abroad, and I want to know why this is so low, and I know, Minister, you said it's a source of frustration, but I think we need more than that. We need to know why this isn't happening, and we need to have, every mechanism possible needs to be used, and every tool at our disposal needs to be used to ensure that these children get the surgeries they so desperately need, and they cannot be left waiting for months and sometimes much longer. I also just want to say, in the remaining time, I think children affected by the unnecessary hip surgeries can't be forgotten. I think there are real concerns there. It's welcome that the multidisciplinary team meetings moved ahead. However, there's concerns around the delay with the external review panel, and that can't be left to delay too long, and I think that is a cause of concern. And there's also concerns there about a lack of accountability and transparency. Minister, you said back in July about referrals to the Medical Council that your department had written to the HSE to clarify the matter. They had contacted CHI, and it'd be great if you could update us on this, on where that is at in terms of those referrals to the Medical Council and what is possible in relation to those cases. And I think we need to see just greater levels of accountability, and we need to see legislation for accountability. I think that is really crucial, and that was part of Statutory reforms, never done, and I think it should be done. Finally, just in conclusion, my thoughts are with families and the children affected. They have, as time goes on, more questions than answers. Harvey Morrison's parents are an example of this. They want to know why Harvey was removed from the list, from the surgical waiting list. Was this a clinical error, or was this a clerical error or clinical error? How could this have happened?
Thank you, Deputy.
How many children and parents who were in continuous contact with
Deputy
CHI have been forgotten?
time.
Just in conclusion, and why were these children failed? Who is to blame and who will be held to account?
Thank you, Deputy Gibney.
Margaret Cancorla, and I welcome the opportunity for statements on this topic. I did push for these to be Q&A rather than statements, given the sprawling nature of the issues that surround CHI. And I want to cover 3 key points today: the real human impact on these families, the constant crisis, which is unnecessary, and the fact that we seem to want to hide from our failures instead of addressing them as a state. I think it's important to spend some time reflecting, though, on that human impact and the realities of the long and painful wait for spinal surgery in this country. These children are left in limbo. They're denied the opportunity to enjoy their childhood and to have the best possible chance at life. Long waiting times have resulted in children no longer being able to get surgery because their condition has progressed so much. They don't get to enjoy school the same way, enjoy playing sport or hanging out with their friends without the worry of medication, of pain, and of hospital appointments, or even worse, of no hospital appointment at all. My heart goes out to the family of Harvey Morrison Sherratt and all the children and families who continue to be affected by a lack of care for scoliosis and for spina bifida. They deserve better from this state, and we must deliver better. But this constant crisis is unnecessary in the face of these repeated failures and the promise years ago from Simon Harris that no child would wait longer than 4 months for surgery. In every new revelation of how these children and their families have been let down, what is most frustrating in all of this suffering is that it is entirely unnecessary. We are an incredibly wealthy country. We have billions going into our health service. We have a national focus and public backing for issues to be addressed. We have a plan to fix the problems in our health system, to introduce an efficient, public and robust healthcare system in Sláintecare. And yet we still have children becoming inoperable because they have waited so long. We have children in pain while their families watch on, because we seem to want to hide from our failures instead of addressing them. Children's Health Ireland has been plagued with scandal, with each new detail worse than the last. We have clear systemic problems in our health service when children are being implanted with non-medical grade devices, when unnecessary hip surgeries are performed on children, and when those children who do need treatment cannot access it or are removed from waiting lists without their own or their family's knowledge. These revelations came out piece by piece. We need to see a public inquiry that delivers for those affected, and we need to see the publication of all reviews. We shouldn't have to be here to talk about what we can do to give these families justice and services. They should have received timely care. But it is left to us now to deliver on the broken promises and ensure that we see a change. And just finally, in relation to the inquiry, because I'm very familiar with the Commission of Investigation Act, and I would agree with my colleague that it has not yet yielded enough examples of human rights compliant commissions of investigation, public inquiries or tribunals. So it is up to the government to use that legislation in the right way to meet the standards and obligations we have to be human rights compliant in this inquiry.
Deputy Naisha Carroll.
First of all, I'd like to acknowledge the Minister's ongoing efforts in relation to this very, very emotive issue, and particularly in relation to CHI as well. And I want to thank her for her help with some issues in Kildare with some constituents. I think it's important that that's acknowledged, and particularly her work with the families at this moment as well. However, it's incumbent to speak about the hundreds of children that are still waiting for spinal operations that are time sensitive. In October, CHI reported 223 children on the spinal surgery list. Around 140 of them are actively waiting. That means they are ready for surgery but still have no date. Some children have been waiting more than 18 months. A very small number have waited more than 3 years. For a child, 3 years can change everything. No child should spend their childhood waiting for essential surgery. These delays are not just numbers. They are children in severe pain. They are nights where a child cannot sleep comfortably. They are school days missed, opportunities lost, and parents watching their child struggle while feeling they cannot do anything to fix it. Families are trying to stay hopeful, but long silences, sudden cancellations and mixed messages take a huge emotional toll. I do want to recognise that progress has been made. CHI has increased throughput. The Spinal Surgery Management Unit has been established to strengthen coordination. Additional surgeons, nurses and specialist staff have come on board. New theatre space and a new MRI have helped speed up care. Children have been sent abroad when needed, and that has offered timely treatment for many families. These steps matter, and I do welcome them. But progress is still uneven. Capacity has improved, yet cancellations continue to disrupt families. Communication gaps leave parents unsure and anxious, and too many children continue to wait far too long for surgery that could prevent long-term deterioration. When a surgery is cancelled at short notice, it affects the child, the family, and their sense of trust in the system. If we want to fix this properly, we need 4 things. First, accountability for delays. Second, full transparency in waiting times and indeed cancellations. Third, clear communication so families know exactly where they stand. And finally, we must follow through on the commitments to reduce long waits. Promises must become practice. This is not about blaming staff. Ireland has outstanding clinicians who want to give every child the care they deserve. They need a system that supports timely planning, consistent scheduling and clear, reliable pathways. Children only get one childhood. We cannot let long waits define it or limit it. If we stay focused, support the health service, support the staff and work with families, we can build a spinal service that is timely, transparent and fully centred on the child. We owe that to the children waiting today. And one image that will stay with me was tweeted by Harvey Morrison Sherritt's mum Gillian this morning of his bedroom door. And with a 9-month-old son at home, it really shook me, and I can't even imagine the pain she's going through. And I think it's important that we all think of not only Harvey but the other children that have been impacted. And Minister, as I said previously, I just want to thank you for your work, and I do think we've a lot more that can be done.
Thank you, Deputy. Just before Deputy McGuinness begins, I'd like to welcome the Chamber of the Dublin Chamber who are here with Deputy Cormac Devlin. You're all very welcome. Deputy John McGuinness.
Thank you, Ceann Comhairle. Firstly, let me say that this scandal has gone on for years under the nose of the Department of Health and all of those involved in what should have been the management of a very serious issue. And nothing was really done during those years to encourage parents to, to have the engagement with their consultants and with their hospitals, and to ensure that there would be early intervention for them. We have seen failure after failure, and nobody is held to account. We have seen in that time significant money being allocated to the Department of Health, and all to no effect. We're now talking about more action and more people involved in the management. So what we have here is a failure of the Department of Health, a failure of those that administer in the context of administration of the hospitals and that, and a failure to look after young people who deserved a hell of a lot better. I can't express my position any better than what Claire did when she wrote to me about her son, Dara. She said that at Dara's outpatient appointment in November 24, I asked directly whether he could be considered for surgery in New York, London or the Blackrock Clinic. I was told emphatically no. In the months that followed, Dara underwent all required pre-op assessments, which were completed and signed off in early 2025, confirming that he was ready for surgery. And despite that, no date was set for that surgery and no further information was provided. His clinical plan was for surgery to take place before Easter 25. That was considered the time frame for the best possible outcome. That is why it mattered. This is a child who has already been brought through so much. He deserved the chance at a best outcome. But that chance has now been lost. As a result of the delay to surgery, Dara's spinal condition has progressed. He now has a worsening lower curve, while the upper portion of his spine has become arthro-fused. At this point, most recent appointment, I was informed that the section of the spine can no longer be surgically addressed due to its complexity. I find that harrowing for a mother to look at her child go through this and then not be able to have the surgery that is required. Claire goes on to say that to make matters worse, I have learned that visiting spinal surgeons from Morgan Stanley were in CHI, not only on the 31st of March and the 1st of April 25, but also in December 2024. These were at least two clear opportunities to put Dara forward for potential care on an international pathway, and both were missed instead. When we attended the clinic on the 3rd of April, we were told plainly there is no date and there is no time frame for surgery. That is not waitlist management, that is abandonment. And I agree absolutely with Claire. And when I'm mentioning Claire, if I hear, look, there are many Claires out there. There are many sons like Dara out there fighting to have their case heard, fighting to have the surgery that would make life so different for them. Claire goes on then to say, I also know that not one child under the care of the Temple Street Service has accessed surgery at the Blackrock Clinic via CHI in the past years. That is a deeply troubling fact. It means that a large cohort of children, entirely based on the CHI site they attend, have had no access to major outsourcing initiatives. This is not equity, this is not national planning, this is exclusion. This causes a fundamental and urgent question. What is the pathway for access to Blackrock Clinic, Morgan Stanley and Great Ormond Street Hospital? Who decides which children will be selected? And it feels like my lovely son was simply overlooked, forgotten, and that is something no parent should have to live with. Now I can point to a second case, again in Kilkenny, where the operation was carried out in 2004, a long time ago you might say. But Connor was seen in 2004 when he was 4, then in 2009 he had surgery. In 2013 he was seen again. Surgery was promised in 2014. Now he's starting to fall out of the system, and he still has not got the surgery required for the problems that he is now experiencing. And when his mother, and I want you to take note of this, Minister, when his mother went about getting the information from 2009 and the various other dates from then to this, she was made ask through all sorts of avenues for that information. She got little or no help. Nobody reached out to her. Nobody understood what she, or wanted to understand what she was trying to achieve. Now this young man carries, if you like, the problems of his childhood right through to his teenage years and now as a young man. How is that right? There is nothing, Minister, that you can say to these parents this evening that will satisfy them in the context of dates and times and the reduction in the waiting list. But I would encourage you to read your emails, which these have been sent to you by the parents, and I would ask you to respond and to engage and to prevent further pain for the families.
Sinn Féin agus Teacht O'Reilly.
I welcome the opportunity to make a small contribution to this debate today. I want to start by paying tribute to the parents of Harvey Morrison Sherratt, to people like Claire Cahill, the Scoliosis Advocacy Network, to the parents of Mikey Sheehy, and to all of those campaigners who time and time again have brought the issue of the scandalous treatment of children with scoliosis to the fore. We really shouldn't know the names of all of these children. They should be able to live their lives in peace and not have to continuously waive their own right to anonymity and beg for every single tiny little bit of attention for the treatment that they need. Families have been advocating, Minister, and I'm sure you'll agree with me, they've been advocating for far too long. I'd say they're worn out. This issue isn't new. This isn't even the first nor the second scandal that relates to this area. Children have been utterly failed by the state and failed by successive governments. I had a look back on the record. Going back to 2016 was the first time that I raised it, and in 2017 myself and the then Minister for Health, the man who's now the Taoiseach, and the Minister for Finance had a debate. The Minister started and he thanked the great efforts of campaigners like the Scoliosis Advocacy Network. He also thanked the staff in RTE that the issue had been highlighted. He thanked me for raising the serious matter and for giving him an opportunity to update the House. Now, this, of course, was following on from an RTE programme, as very often happens. You know, people have to go to the media to bare their soul to get any attention from the government. And he told me, he assured me that improving scoliosis services was an absolute priority for him and his government. He went on to say that he was monitoring closely, indeed on a weekly basis, the progress being made on addressing the waiting lists. He went on to say that the hospital group and the HSE had confirmed that they are committed to ensuring that no child will be waiting for over 4 months. And he himself said that he would be monitoring those waiting lists, not on a monthly basis, Minister, on a weekly basis. So what happened? The attention of the Minister was right on this, on a weekly basis. He confirmed it in the Dáil. What happened? Hopefully, the inquiry will get some answers, because I think the parents have waited for far too long. They've been let down by far too many health ministers, and I really genuinely hope they get the answers that they so desperately need.
An grúpa technical for Chonja Neamhslaki agus Partia Teachta Paul Murphy.
Thanks a lot. I welcome that we're finally going to have a statutory inquiry into care of children with scoliosis, spina bifida at CHI. I think it's very unfortunate. I think it's outrageous that it has taken what it's taken to get to this point that we do have an inquiry. It's a long time that campaigners have been calling for one, and some of us in the Dáil have been doing so. Not just the hundreds of children who have been left waiting in pain, getting worse, in some cases becoming inoperable. Not just the scandal of the unnecessary, unlicensed, non-medical grade, non-medical devices, springs being inserted inside children. Not just the death of Harvey Morrison Sherratt, after having previously been wrongly taken off a waiting list. Not just the outpouring of anger that we saw on the streets at the end of the summer around the idea of justice for Harvey, but I think represented the idea of justice for all our children who are being failed, in particular by CHI, but in general also by the state. But then added to that, the really horrifying revelations from the whistleblower in terms of the treatment of Harvey, of the idea that he was palliative, and yet then nothing seemed to happen in terms of palliative care. And then again at the weekend, again, like an awful way of speaking about a young child, saying that he wasn't, quote, fit, not fit for a sneeze. Awful stuff, awful that parents have to hear it and then speak out about it. I do want to pay tribute to Gillian and Stephen for speaking out, and obviously at a moment of immense grief. And all the campaigners and the advocate groups who have been pushing for so long for, and really shouldn't have to, for justice, for answers, etc. For me, the key issue in terms of the inquiry is that it is done, co-designed with these families and the advocacy groups with their agreement. I understand what they want to see is a tribunal of inquiry that therefore happens in public, powers of compellability, all of that, and if we could have a reassurance that that is going to be the approach of the government, that would be very, very welcome. I want to raise some related issues. One, just to ask the Minister about the status of the NIAGM report. I got a PQ answer in, it was October, where say that it started in September 2023, we're now in November 2025. The risk assessment aspect of the review has been completed and is being considered. Can I ask that the risk assessment will be published in full and in not be redacted? Can I ask the Minister whether that's going to happen? Secondly, I would say in relation to what flows from the NIAGM report, and obviously that particularly relates to a particular surgeon, that we should not be limiting an investigation of what happened to children. I've been contacted, I've mentioned it, I think twice on the Dáil record before, by an adult patient of this surgeon with a lot of concerns. I'm obviously not qualified to say whether there were problems or not, but I think at the very least, given what we know, adult care also needs to be looked at. Also want to ask in relation to CAPA being fully included. I've previously referenced the email from the clinical director at CAPA ending the MDTs because of osteotomies not happening. Also want to ask about why it's still, I got a new PQ answer saying that there are still, in terms of the hip dysplasia, still and the osteotomies still only going back to 2010. Even though we know that they go back, that these novel osteotomies go back to 2002, it makes no sense to me. And finally, on another issue, the Minister might help me get PQ answers. I've put in PQs back in September in relation to DIPG, which is a form of brain tumour, very aggressive brain tumour, and basically the number of biopsies that are happening. I put PQs in September. Early September. I'm still waiting back for answers from the HSE. But effectively, it's come to my attention that Ireland may be doing an unnecessary number of these biopsies, a lot of biopsies when other countries are not, potentially with fatal results for children. So I'm looking for answers on those.
Dr. Carpenter.
Minister, I'm in a small party, so I don't get as much speaking opportunities on this issue as other bigger parties, but I've been in here, and as have us, many times asking for a public statutory inquiry from the word go. I've known Gillian and Stephen, particularly Stephen, for just over a year. So before the particular tragedy in relation to Harvey, I think we do have to ask. We have to learn lessons from this, because time and again on so many issues, parents and relatives have to campaign again and again and again for years and years for justice on these questions. And I do remember saying that we would be in here, we would have a statutory inquiry. And I do have to say it should not have taken the death of Harvey to get this, because I do wonder, had he not died, would we be still in here asking for this? We have to be honest about that. And also, if the whistleblower hadn't come out and spoken out as well. I just want to make a quick point about the inquiry and then a quick point about the waiting lists. I think participation in the inquiry has to be mandatory, and also, very importantly, because this has been raised by parents, children who were affected by this should be allowed to testify. Many of them are older now, and they should be listened to, and I think that's really important. And I think that if issues are found in the process of the inquiry, they have to be dealt with there and then also. You can't just wait until the end of the inquiry, because we all know it could take some time. But I wanted to ask you, because parents have raised this, do you, Minister, specifically have faith still in the Spinal Task Force, given how badly it has failed in its role? The Paediatric Spinal Task Force group was explicitly created to decrease the waiting lists. Had its first meeting in May 2024, and at that time there was 246 children on the waiting list. And in October 25, there's 223 and another 139 actively waiting for surgery. It has failed in its objective. It was complemented by the Paediatric Spinal Surgery Management Unit, very hard to get your head around all of these terms, who are meant to be in charge of managing spinal surgeries, and that is the unit that is directly implicated with Harvey falling off the list. Now, whether it was a clinical error, as the whistleblower claims, or whether it was an administrative error, as a newer report claims, is irrelevant. It still failed. That task force, that group of people failed to treat Harvey. And there's other examples of incompetence there with 10 children who were crossed off the waiting list by somebody under orders. That person apparently was disciplined for that when they were actually just carrying out an order. Other children have been harmed, as Harvey has. I also want to raise about staffing. I won't have time to raise all the points, but it was found staffing, it's really hard to fill posts, as we know, throughout the care system. Of 52 approved posts, 34 have been filled. So is that another problem that we have? And the culture of staffing as well. Anyone using the term not fit for a sneeze shouldn't be working in the health system, or should be, it should be taken up with them. How acceptable is it for people to talk like that? And Minister, what needs to be done very quickly to bring down the lists? Two things were raised: either requisitioning space at other hospitals, the private health system, which is packed to the gills with equipment and money, or sending children abroad. And yet we find only 2 children were sent abroad for treatment, despite a ministerial order to give all parents that option. So I think that has to be questioned, why those lists are still so high after all this time.
Inish Arashkajian Realtis August Chocta Daily.
Thank you. Look, Minister, every one of us in this House has met families whose lives have been shaped by scoliosis or spina bifida. These are families who don't have the luxury of waiting until next year for improvements. They need treatment now. As a GP, I've seen how timely spinal care can change the entire trajectory of a child's life. And that perspective shapes what I want to say today. Yes, progress is being made, but we have a long way to go before any of us can be satisfied. We need to be honest. Too many children have waited too long for spinal procedures. And while some indicators are now moving in the right direction, nobody should pretend that the job is done or that families can suddenly feel reassured. They don't, and I don't blame them. Up to the end of October, 446 spinal procedures have been completed, slightly more than last year. But demand is rising even faster. 462 new cases have been added to the list this year. That tells its own story. We are adding cases more quickly than we are clearing them. There are improvements. 68% of children are now waiting less than 6 months, compared to 56% a year ago. Those waiting over a year have halved. Outpatient lists have fallen by almost 50%. These are signs of a service that is trying to pull itself out of a very difficult period, but it's also a reminder that the gains are fragile and that the system is still heavily stretched, especially when one retirement or one ICU bed shortage can derail a week's worth of surgeries. I welcome the hard work of clinicians, the spinal management unit, the multidisciplinary teams, the new transition pathway for adolescents, because it is their efforts that are turning numbers into reality for families. But I will also say this: they need more support, more capacity, and more consistent communication structures. Families cannot be left chasing letters, clarifications, and updates. The various reviews, the HICWA report, the Boston review, the internal examinations, and the ongoing Nagayam review are not comfortable reading, nor should they be. If anything, they show that oversight didn't come soon enough. The audit into governance and equity of access is essential and frankly overdue. Families deserve transparency, not a maze of inconsistent processes and varying standards. The planned statutory inquiry into spina bifida and complex scoliosis service is a necessary step. It is not a tick box. It is not a gesture. It must be a turning point. I want to acknowledge the families and the advocates whose persistence has brought us to this point. They've shown more courage and patience than any system should ever demand of them. As for the integration of CHI into the HSE, it may well be the right long-term move, but let's be clear, structure alone won't fix culture. Governance changes must be matched with accountability and day-to-day improvements felt by real families. Colleagues, progress is real, but it is not enough. We need more theatre capacity, more consultants, better planning for surges in demand, and communication that treats parents as partners rather than supplicants. If we want families to regain trust, we have to earn it. As a GP and as someone who believes the health system should serve the most vulnerable first, I will continue pushing for urgency, honesty and accountability, because these children deserve nothing less. Thank you.
Dr. Callaghan.
I would like to, from the outset, acknowledge the work of Minister Jennifer Carroll-MacNeill, who, since she has become Minister for Health, has been very proactive in tackling many pre-existing inefficiencies in the health system. It's important also that I acknowledge and recognise the very hard-working staff that we have within our hospital system. So none of what I'm saying is a slight at those dedicated and committed members of the hospital network, the HSE or indeed CHI. It is very apparent since Minister Carroll-MacNeill became the Minister for Health that she is actively driving multiple efforts to address the challenges that have been ongoing in relation to paediatric spinal surgery waiting lists. I know from conversations that we've shared, Minister, that you met with the HSE and CHI board and executive in both August and September, and that you were very clear in ensuring that everything possible must be done to reduce the amount of time that children are waiting on procedures. And I'm heartened to know that further meetings will be taking place and are scheduled. At the end of October, indeed, 68% of patients on the active waiting list were waiting less than 6 months. And this does mark an improvement from this time last year, when it was 56% of patients were waiting less than 6 months. But any time a child is waiting for spinal surgery is too long. And I have to share the following example with you, Minister. A young child in my constituency has been recommended for surgery for over 2 years now. They have had pre-op appointments in early 2024 and 2025. They were offered surgery abroad and were indeed due to travel to New York for spinal fusion last March. But the child's parents were then advised by the medical team that surgery in Ireland was in the patient's best interests. And indeed, the family were assured that surgery could be and would be completed by summer 2025, as the child is only 10 years old and was therefore classed as a priority case. Then in June, the family were informed that before spinal fusion could take place, additional surgery was also needed, even though this was first identified by MRI in 2019. So that's a wait of 6 years before this surgery happened. Now, I am happy to report that the surgery was successfully performed on the 1st of July, and by August, the child in question was ready for their spinal fusion. A date for surgery was confirmed for just last week in November, okay? So not the end of summer 2025, but indeed November. But unfortunately, 4 days prior to that surgery date, the surgery was cancelled. Now, due to an emergency case, which I can appreciate, but no further plans or details were given to the parents. So you can imagine the feeling in that family that time. And indeed the child saying, why am I not an emergency case? I've been waiting so long. So, Minister, children and parents like the ones that I have just spoken about are at their wits' end. So can I please appeal to you to keep up the drive that you have brought to this role, and to ensure that the ambition and what you want to do is carried through. And I understand that that is a challenge, but to recognise the work that you have done to this date, because the children of Ireland, they need that drastic change at the speed at which they access the treatment that they so desperately need, and the prolonged waiting needs to stop. Thank you, Minister.
Excuse me. Good morning. Minister, firstly, I want to express my sincere condolences to the family of Harvey Morrison Sherratt. While he was failed by the state, he was very lucky to have such loving, strong parents, Gillian and Stephen, who fought, who did everything they could to get him the treatment he needed, but unfortunately it came too little too late. But they continued to fight for all children like Harvey. Before coming here today, I rang a constituent of mine who has a son who has scoliosis and who is in a wheelchair. And I want to let you know, Minister, that these are issues that are directly coming from people who are in the front line. her child doesn't qualify for scoliosis surgery because his curvature of his spine isn't considered severe enough to join the waiting list. If he lived in England or America, he would be on the waiting list for surgery. For children, the criteria is too high, I believe, from what I'm being told by parents. The more severe cases are on the waiting list, but these children are left waiting for months, if not years, for urgent treatment and surgeries. As his mother feels, she believes that early intervention will give her son the best opportunities in life and the best chance to correct the curvature of his spine. This system is in chaos. Well, parents are watching on about scandals, about springs, hip operations. How can parents have trust in the clinical decisions that they're hearing right now? And her son is losing out because he was born in Ireland. If he was born outside, and he's also losing out because he was born in Cork, and I'll explain why. He has two choices when he's at home. He can be in his wheelchair or he can be in bed. There's nowhere else for him to be. He doesn't have a second chair, a specialist chair, where he can sit down, watch TV, have meals, play games. Like, what kind of a system are we running when a child who's in a wheelchair hasn't the ability to get out and get into another chair that's suitable for him? Like, these are basic necessities for children who have disabilities. Like, I believe this is all wrong. And how are we running a health service like this? It should be based on need. It should be based on dignity. It should be based on clinical decisions. But instead, it depends on where someone lives. Is it a postcode lottery? Because this parent told me she knows of other parents whose children do have access to that. And to finish, this government, I believe, should be ashamed of themselves, the way they've acted and they've treated these children and these families. And yesterday we were in here, and Simon Harris, the man who broke his promise to these children and these families, and he gave himself another promotion now as the Minister for Finance. But all that people will remember his legacy is a legacy of broken promises and failure to the most vulnerable children in this state.
Nish on Group of Technical Nerves Block, August Chapter Collins.
Thank you very much, Chairperson. Minister, our health system has failed some of the most vulnerable children in the state. In 2017, a clear promise was made: no child would wait more than 4 months for spinal surgery. That promise was broken and the consequences have been devastating. Right now, 139 children are actively awaiting for spinal surgery this year. 446 surgeries were completed, yet 462 new patients joined the list. We now know that this 4-month pledge was based on assurances given to the then Minister by the HSE leadership and senior officials at Children's Health Ireland, who told him the target was achievable. Those assurances were wrong, and parents paid the price. The tragic death of Harvey Morrison and allegations that he was removed from the waiting list because he was deemed palliative has shattered public confidence. Harvey's parents have been clear about what they want: a statutory public inquiry with full powers to compel evidence, a broad scope to uncover systematic failings across decades, accountability for those who made harmful decisions, and above all, real change, ring-fenced funding, stronger governance and a national spinal treatment service so no child suffers like Harvey did. The government has now agreed to an inquiry, but this cannot be a box-ticking exercise, Minister. It must be family-led, transparent and fearless in exposing the truth, and when it concludes, its recommendations must be implemented, not ignored. So I ask the government benches today, will you commit that every recommendation from this inquiry will be implemented in full? Will you guarantee ring-fence funding and a timeline for reform? Because anything less is another broken promise. There can be no more broken promises, and there certainly can be no more preventable tragedies.
Thank you. Minister, you came to Limerick and we opened the 96 beds. I welcomed it. We now have A, B and C, which we are looking for in Limerick for the care of people of the Midwest. We also have people that have come to us that are developers that say that if you haven't got the money to build these facilities, they will build it for you and they will sell it back to you for €1 after 35 years if you haven't got the money. And the reason why I'm saying this is now our new Minister for Justice, who was in your position and had failed in your position, where you are excelling in areas where he didn't. I'm hoping that he will not stop the funding for the delivery of healthcare in Ireland. And I do hope that it doesn't become a political situation where he sees you as a threat to his leadership and he also fails in this respect. We have a chance now to deliver infrastructure for the care of people of the Midwest and in Ireland if they allow you put procedures in place where we can have buildings where we can actually care for people. And I don't want money to stand in the way. I want delivery on budget, on time. I do believe you can deliver it, and I do hope that nothing stands in the way. So if the budget doesn't allow for it, there is people out there that will develop these projects for you and give you the infrastructure that you need to make sure we can have delivery for people, care for people in a short length of time. Thank you.
Thank you, Cathaoirleach. Minister, I'm 18 years in public life, having served as a city councillor in Cork and having served for almost a year now in this House. And I have to say to you, Minister, there isn't a day has gone by or a week hasn't gone by where I've met parents with some special need child or some difficulty or some need for an operation that have the pen to the collar, that are desperate. Because you know what? I think, I'm not a parent myself, but I see it with my brother and I see it with my sister-in-law and my brother-in-laws. I see how they are with your kids. You'll kill for your kids. If you could take their pain, you would take it on you. And I see these parents struggling when they're talking about their children, trying to get them therefore into operations, trying to get their services and the attentions that they need, trying to get the right social welfare and criteria for them. And then I hear excuses in this House of we're going off and we're going to, I'm dissatisfied with the amount of numbers that we sent to Great Ormond Street, or I'm dissatisfied with the numbers that we've sent. This is going on, Minister, since 2012. 2012, if we read the timeline, over 10 years ago. We're looking at September 2023 when the safety and governance was brought up. We're looking at 2012 where the context was raising about the hospital. We're looking at 2016 where failures for the 4-month pledge were first noted in this House. And on and on and on. Minister, I welcome the inquiry. I wanted the inquiry. We agreed that we would have the inquiry. But this inquiry has to finish. It has to have teeth in it. And people have to be held accountable for it. And I can tell you, Minister, the assurance that you gave this House this afternoon, Minister, honestly, no parent will sleep well tonight with a sick child worrying about them with the assurances that you have given this House today. Thank you.
It's good that we have the opportunity to make some statements, particularly after the announcement that a tribunal of inquiry is to be set up. It's welcome news, but I'd be very interested in the terms of reference when we actually see it on paper and when we have sign-up with all the families involved and all the children involved. Because at the moment, as others have said, we may have made some progress in reducing numbers, but then the numbers coming in are coming at a faster rate. And there have been questions over why children were bumped off the list before, and this hasn't been answered. There is no accountability. I mentioned in my previous contribution about parents having legal action threatened against them for trying to advocate for their children. So these issues, unless they're going to be dealt with moving forward concurrently with the tribunal, we're going to have problems. And in that respect, I just want to talk about some of the demands made by the children with scoliosis and spina bifida and their parents. How many seconds do I have left?
20.
20, okay. The children who've aged out of services must be included, that there's a transition pathway for scoliosis and spina bifida, that the consequences of neglect by CHI are addressed, the children who've passed away must be included, that it must compel persons and documents to participate, and that healthcare reform improvements have to be implemented while the inquiry is ongoing. That's what they're looking for alongside, so hopefully that can be dealt with.
Minister, in your opening remarks, you said that your door was open to TDs to bring specific cases to your attention. So I've engaged with your department, for example, in relation to Mikey Sheehy, who was so long on the waiting list that he aged out of it. They shut the door to me, the department, saying that it's not our place to intervene with clinicians regarding the care of children. That's one problem. The second issue I have is, if we're honest, you have been stonewalling questions on this issue for a number of months. It's been 14 months, Minister, since I raised the question about Harvey Morrison Sharrett's removal from the waiting list. And I asked how many other children have been removed from that list. And you told me that you would answer that question soon. You said in October that you'd answer the question in November. That question has not been answered as of yet. That is absolutely startling. That information is still not available to people at this moment in time. The question I ask you now, when will you let the Dáil know what's happening in relation to that? I've asked as well, in terms of CHI, that they haven't published their 2024 annual report yet, in terms of accounts and spending. I've also asked the questions around the funds for surgeries for children abroad, and how come there's nobody on that list at the moment scheduled for operations abroad. And in all the months that we've been talking about CHI, the situation is actually getting worse for so many families. We need to have difficulties in relation to this inquiry. First of all, how it refers to complex scoliosis. Now, there's no definition of complex scoliosis in the document so far, and we're worried that this is an attempt to water down the number of children who will form part of that inquiry. I'm also disappointed that the statement announcing that the inquiry is to happen was seen in the media first by the advocacy groups in relation to these children as well. How many children have been removed from CHI waiting lists without their parents' knowledge? I'm going to ask the question again. How many children like Harvey, Morris and Sharrett were wrongly removed from the waiting list? How many children have died while they're waiting for surgery in this country? How many children have been removed from the waiting list without surgery who have aged out? And outside of the inquiry process, will you commit to furnishing this House with that information, that basic details that should be available at any stage to any TD who's asking a parliamentary question of yourself? The Boston report said that one child went back for 33 surgeries, but because of the CHI data, it looks like there's 33 children operated on. So there's a lot of confusion in relation to these figures, not enough transparency in relation to these figures. And given all that's happened here, the very least that the citizens of Ireland are entitled to, the elected reps and these families themselves are entitled to, is transparency.
Inish na Coltiella agus Tosoimridge le Chapter 2.
Sa cathairlig agus ara agus ní lisa gom muna méid mo cóide sa seomar gan Tamil. Thank you, Minister, for your update. Very comprehensive. I was here earlier and I had to step out for a while. I suppose I'm going to confine my comments just in case my colleagues do thunder in, and I can go back if necessary. I'm going to consider 5 A's, like an A rating. And the first A is that the consideration, and you have addressed even one already, the asks of the parents and the advocates of the children. The second A is to acknowledge the conscientious and hard-working healthcare professionals already involved and over the last 13 years and probably longer. The third A is probably the most serious, and I would consider it the common denominator, no matter what subject we discuss here in relation to healthcare. To my mind, and it will be a science background, it's always to get to the why, the what's happened, but more importantly, why has it happened? And it's the issue of accountability, and that's accountability by senior HSE management. And if we look at the mission statement of the Health Service Executive and the values, and they're listed as care, compassion, trust and learning. And we have had a breakdown on several fronts in that regard, and that is a key area. The fourth A is action, and again that's linked to the first, the asks. But I would ask you to consider the 2024 scoliosis bill brought forward by Senator McDowell, because the accountability is built in. And number 5, to go back to the beginning, to acknowledge your efforts in a very short space of time against a system that's stacked against you.
Dr. McGrath.
Good. Mr. Brett, look, delighted to be able to speak at this, and I'm delighted that the Minister is conscientious and listening to the debate. Very important. Minister, look, this has to be sorted out. I raised today, as in the order of business, a promised legislation about the children and our teams, disability teams in Clonmel, so depleted. 11 staff vacancies there with years. So, Mullinor, I was chucking I said, and their children that have, some have varying degrees of needs and some very little, but they need assistance. But this scoliosis is just beggars belief. Beggars belief. Such a profound, challenging, illness, and so obvious to the parents, but obviously to anybody. And I said here some years ago, this is debated, that there was some proposal to send the children, the patients, to America by plane. Obviously, that was a no-brainer because you couldn't travel by plane because of the condition. But I suggest that time, if we're serious about this, we would get some specialist surgeons from the United States or wherever, and bring them in here, deal with the backlog and the waiting list. I don't have to remind you of what your leader and Taoiseach promised and what happened there. And I think that money went in there, money was ring-fenced, and it wasn't ring-fenced, it got used up elsewhere. What kind of an out-of-control HSE health system do we have here that's so seems to lack in total compassion and empathy? There are many, many good people. My late brother was a paediatrician of some renown, and he cared deeply for children. I know many, many health people do. But it's the management, and just as a bland word, you can say management. How these systems, can be so callous and so unempathetic, and how they can deal with that on a daily basis and see that problem and just walk away from it. It wouldn't happen on farms. It wouldn't be allowed to happen. It's so devastating for families. So devastating. And we saw loss of life, and we saw how, files were entered wrongly and wrongly classified. So simple to say that, but it's so deeply hurtful and so deeply troubling to parents and to anybody with a heart and a human. So the HSE is not fit for purpose, hasn't been. CHI is not fit for purpose by any manner of means. TUS is not fit for purpose. But we keep piling on and giving them more and more money and adding more and put on directors and let them all have nice, big, fancy titles. And the basic, decent humanity of a required surgery can't be done in a timely manner. And if we haven't the expertise here, we should be importing it from abroad and try and show some compassion. Otherwise, we should fold up our tent in here and go away, and we're like a third world country. It's shocking, and it just hurts me deeply to have to talk about it. Thank you.
Cormagat Masrud Nachwell, Five NRB, Tularashkaji, Sinn Féin, August Chapter Ward.
Minister, I just want to wish you well as you tackle this issue. There's nobody in any side of the House here that doesn't want to see children get timely access to the care that they need. And I want to commend the advocates who have long been calling for a statutory public inquiry into spina bifida and complex scoliosis services. And I cautiously welcome that the government have agreed to this. And the reason I say I cautiously welcome, because the terms and reference have to be spot on in this, Minister. We've all heard about the unregulated springs used in operations in children, the unnecessary hip operations. So we need to find out from a governance level what actually led to these failures in the first place, so this does not happen again. We simply cannot allow the wreckage of the past and a toxic culture in CHI to take hold in the new CHI hospital. The scope of this public inquiry must also not be too narrow. We do not need to see little bits of the jigsaw, we need to see the whole picture. The public inquiry must look at this, and they must be able to compel people to appear, so simply just to get the answers. Documents must also be compelled to help the inquiry. The facilitator appointed to consult with the stakeholders must be independent, and they must ensure that no cohort or particular group of children are left out of this process. We need to have an overall view of the care children have received, and this includes an investigation into the deaths of children, and if these deaths of these children are linked to waiting on scoliosis surgery. The inquiry must also look at children who had post-op complications, including infections. The inquiry also needs to look at HICWA's role in all of this and why they did not sound the alarm bell sooner. We need to see full accountability. The tribunal should be able to issue recommendation while it's ongoing, and that's what the advocacy groups have been calling for, and that these recommendations, while it's ongoing, are implemented in a timely manner. Minister, it would be remiss of me if I did not mention the tragic death of 9-year-old Harvey Sherratt Morrison. I've got to know Harvey's parents, Stephen and Gillian, over the last couple of years. They've tirelessly campaigned, both before Harvey passed away and since his untimely death, for better healthcare for children. Last year, I asked in this House why Harvey was removed from the waiting list without his parents' knowledge. And today, as we speak, Stephen and Gillian still do not have an answer to this. We've seen reports, well-known reports, I know you're well aware, Minister, from a whistleblower stating that Harvey was removed as CHI deemed him to be palliative. This is totally unacceptable. We just need to get to the truth of this, Minister. Why was Harvey removed from the list? Who knew about it and when they knew about it? But this is about a CHI level and also at government level. And it's not about a witch hunt or anything like it. This is just about finding out what happened so it doesn't happen to another child. Harvey's case must be a reminder that management and political failures have real-life consequences. We need to see full accountability. The statutory inquiry should be how we finally get justice for Harvey.
Inish, Ara, Todd J. Bombajagat, Concretely.
Agus, and I want to try and address all of the points, but there's a time limit, so let me try and address a couple of things quickly and then some of the more detailed issues. In relation to the 2024 annual report for CHI, the annual financial statements are with the CNAG. The intention is for it to be published by year end. It's currently with the CNAG. When Deputy, and forgive me, I can't recall who mentioned infection rates, I think it is important for me to acknowledge that there had been significant difficulty in the past, but that is reducing. So, for example, the SSI rate essentially had been in 2022 8.7%, 23 and 24 4.4%. This year, pleased to be able to say that it's below 3%, 2.9%. So that is a significant improvement, and I hope will provide some confidence to families who have correctly raised this in the past as being a big issue. It is very much reduced. I think that's important. Yes, my door is open to bringing cases, but it's not as though I will be able to clinically intervene. What I can do is try and shine a light on the management of the case and make sure that, particularly for those most urgent cases, which is a real concern to me, I have met many of the families directly myself, and I'm aware of the difficulties. I'm not a clinician, I never will be, but I will do everything I can to make sure that the correct attention is shone on those most urgent of cases. In relation to the NIAGAM report, two things. The CEO of the HSE has assured me that the matters that led to NIAGAM are being attended to in major improvement plans in patient safety measure, and the report itself is not being waited for to action that. Nevertheless, it is important that I also say that the CEO has also advised me that for significant legal reasons, he cannot at this time appraise me of the report, but we hope may be able to do so in the near future, and that is a significant legal issue in relation to that, and I can't go any further than that. In relation to the audit, and a number of deputies correctly asked me about it because this is a really important part of waiting list management. I'm informed that the qualitative element of it should be with the CEO at the end of November, so I would expect to be in a position to publish that, within December. And the technical draft of the actual more quantitative audit element that's being done by the internal auditor will be technically available in December, but there's always a procedure to triple check essentially. I can't recall the audit phrase, but there's a triple check procedure when you're producing data of that kind, and that will happen within December. We will publish it as early as possible outside of the normal quarterly cycles, but that has to happen. In relation to the task force, there was some very strong and I thought somewhat unfair criticism of the Paediatric Spinal Task Force that I think is very important to address. The Paediatric Spinal Task Force, which is an entity that is separate to the management within CHI of the management list, I think it's really important to say that. Its terms of reference are to its membership, first, is Mark Connaughton, Senior Counsel, is the Chair. There are exceptional advocates for spina bifida and for scoliosis who are on the task force. And then there are also exceptional advocates who are not on the task force. And all of them are contributing to the improvement of services. And I want to thank all of the advocates, both on the task force and off the task force, and indeed all of the advocates, whether or not on the task force, will all contribute to the development of the terms of reference and all have a lived experience directly, either as the parent or as somebody with spina bifida or scoliosis, and they all have very important perspectives and all have done exceptional work. So the membership is Jerry Maguire from Spina Bifida and Hydrocephalus Association, Elaine Kelly and Deirdre MacDonald, both of whom are Scoliosis Awareness, Lily Collison from cerebral palsy perspective, and then there are different departmental HSE and CHI representatives. The terms of reference are to engage with stakeholders, to listen, engage, act on advice and the concerns of parents, outline improvements, engage on development and delivery services, engage with HSE Spinal Management Unit, and provide oversight and assurance. And I really do want to thank them for their work. It is an ongoing piece of work. It really has contributed valuable information, as have those advocates who also are outside it. And, you know, neither is better. Everybody is contributing their experience for the benefit of the improvement of services. And I really do want to thank. And I think it's also important to say, because I think it was Deputy Coppinger who didn't quite, may have simply just confused the two pieces, but it has no operational oversight. It is not responsible for that. It is a group to try to improve the services. And it is different from the unit within CHI that is responsible for managing the waiting lists that was established last year and is not. In relation to the inquiry, I think possibly most importantly has been raised by a number of different deputies, and there are a number of different, forgive me, a number of different issues that I need to try to address. Those things that we can say with certainty. It will be a statutory public inquiry. It will have the power of compellability of necessity. We will also continue to try to drive improvements at the same time. Those things are not incompatible. We will engage absolutely with families, with children in a voice of the child appropriate way. We will engage with stakeholders, the different representative groups, the different advocacy groups, all with a view to developing the best possible terms of reference. Now, deputies have said here in here a couple of, if I may say, slightly competing things that I think it's really important that we together address. We want an inquiry that can have the power to investigate the issues that are of shared concern to us. We want it to be an inquiry that will report, have teeth. It is a fact-finding inquiry. So if it is a fact-finding inquiry, we can't necessarily take things as they are happening if the chair of the inquiry has to go through their own process. Like, we are moving into a legal process that has to be managed by the chair of the inquiry, that we will not be able to interfere with, nor should we, but also a legal process that's capable of legal challenge as well. And as we draft the terms of reference, we don't want them to be so tight as to not do the work that we want it to do, nor do we wish it to be so wide as to either run into legal challenge or get to a point where we don't ever get an outcome to it in a way that's appropriate. I don't wish to set a time, I'm not time-bounding it, I'm not limiting it in any way, but I'm just very conscious that in the past we've had discussion in this House about the need for an inquiry into a matter of significant and urgent public concern, and it has taken many, 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 many years. I'm thinking of CiteServe, for example, which I think it's fair to say deputies may agree went very considerably beyond the term of its discussion. And I'm not trying to limit it in any way, but what I am trying to say is that it is the government and the Oireachtas that both set and sign off on the terms of reference in every imaginable way. That will be done in collaboration and agreement with the advocates. But there is going to come a point where we have to agree that we are reaching the best possible position for the functionality and the legal endurance and robustness of an inquiry which is capable of challenge, one which is going to be operationally effective and possible for the person who is chairing it, and one which is going to reach the sort of outcomes and findings that we find. And I think it would be fair, if I don't say this now, if something happens to the inquiry 6 or 12 months or 18 months, you will correctly say to me, you didn't do it right. You didn't set up the terms of reference right. And I'm trying to set out at a very early stage the need for honesty and the understanding that we are operating within legal constraints and that it has important implications. I will work with the members of the Health Committee in a public and private way, for example, to try to outline all of the different issues that I see coming up. I think it's really important that we have the advice of the facilitator, and I would suggest that we work together, both publicly and privately, because it is the government and the Oireachtas that sign off, both to have the best possible expression of all of the interests of the stakeholders that contribute to it, and to take the steps with legal advice that we believe will give us the best, most robust model of inquiry as well. And I'm just trying to set that out honestly. I don't want to walk into a brick wall with something that we all know is so very important. There was a question in relation to hip dysplasia. And the chair has been appointed on October 24th, and that work will begin. I think it's also important to say to the House, because I have this knowledge and I want to make sure that I share knowledge as I have it in the most appropriate way, that within the last 2 weeks, CHI has written to, as I understand it, and I'd like the opportunity to delve into this tomorrow, but I don't want to hold information that I could give to the House and not give to the House. CHI has written to 81 families, 81 patients who have been waiting longer than the period that we would want, to try to set out the parameters of international travel and how that might work, recognising, of course, that it has to be clinically appropriate, that it takes a certain length of time. But there has been, within the last 2 weeks, an effort to engage again, or to engage in a different way with families to look at that international travel option. I will get more understanding of this as I meet with CHI tomorrow and over the next period, but I just think it's an important update for the House that I couldn't have and not share. And I hope that I've tried to address as many questions as possible, and I thank the House.
Sin Creek le Rochas Modula Listi Fehav de Munliach Drumlick Paediatric August Dus Kaimage Jail le Shaw. So